Hey everyone, my name is Dr. Galatia Strong. I'm a physical therapist who got a 100% on my NPTE, and this led me to found SPT with Me, which is an NPTE prep platform. If you enjoy what you see, check us out at sptwithme.com for our prep courses when you're studying for the NPTE. Now onto what you're actually here for, let's talk about the facial nerve, cranial nerve 7. As you can see, this is an anterior to posterior view of the thalamus and brainstem. You can see the facial nerve exits the brainstem ventrolaterally at the level of the pontomedullary junction. Pontomedullary meaning the pons and the medulla. This is the location of where those two meet. Here's an image that takes out the rest of the clutter, hopefully making seeing where this nerve exits a tiny bit easier. This is a posterior to anterior view, same structure, thalamus and brainstem, so we're looking at the backside. Here you cannot see the nerve from this view because again it exits ventrally. This is the same exact view as the previous image, but we are looking at the location of the nuclei. You can see where the nucleus of the facial nerve is with respect to how high or low it is within the pons. However, in this view you cannot see how deep into the pons it is, so you will have to have a different view. So I want you to note as well that there are other nuclei to pay attention to. The superior salvatory nucleus, and this is also associated with this cranial nerve. This is what I was talking about before. This is a top-down view of the pons, a transverse cut. So you can see with this image how deep into the pons the facial nucleus is. You can see it's towards the posterior aspect of the pons. It's not literally at the very edge of it. And I'm just pointing this out because you need to understand that when you're studying cranial nerves, you have to have a lot of different points of view because these 2D images do not show you everything. Now in this view, you can compare it to where the facial nucleus is to the abducens nucleus, cranial nerve 6. You can see that the fascicles that come out of the facial nerve actually loop dorsally around the abducens nucleus before it exits the brainstem at the pontomedullary junction. So you can just see how it loops around. Here is a lateral view, same structure, thalamus, brainstem. You can see how it exits at the ventrolateral aspect of that pontomedullary junction. A different view showing the same exact thing. Before we start talking about the pathway that the facial nerve takes, it's important to know its functions. It makes it a little bit easier to understand. Now clearly, there's a lot that it does. It has both motor and sensory jobs. And within both of them, we end up having 4 different tasks. So first of all, for motor involvement, this is probably the thing that we normally think about immediately with respect to the facial nerve. It innervates all the facial muscles. Yes, this allows us the opportunity to express our emotions. Now, aside from that, it's not only face muscles. This nerve actually innervates other muscles, including the stapedius. This is a tiny muscle of the ear that serves to essentially control the amplitude of sound vibrations when they enter the ear. So the purpose is to dampen the vibration, that way we don't damage our hearing mechanics. Another muscle that is innervated by this nerve is the stylohyoid muscle. And another one is the posterior belly of the digastric muscle. This one has a role to assist us in swallowing and chewing. So again, the first things that we normally think about are innervation of the facial muscles. However, there are other muscles that this nerve innervates. Now going on to the parasympathetic role. The nerve innervates the lacrimal glands, the sublingual glands, the submandibular glands, and all salivary glands aside from the parotid gland. So lacrimal glands, you think of tears, eye ducts, right? All other glands that I mentioned, remember, not parotid, they are salivary glands. So it's going to produce spit to be able to, get food to soften up when you're chewing and eventually swallow it. Now onto the sensory roles. It has 2 sensory roles. One is a special one and one is a somatic one. The special one is taste, and taste specifically at the anterior 2/3 of the mouth. This might kind of ring a bell because if you recall, the trigeminal nerve, nerve number 5, provides sensation at the anterior 2/3 of the tongue as well. But it's not a special sensation. Facial nerve gives that special sensation of taste. Trigeminal nerve gives somatic information, so think pain and temperature and texture. Okay. Now lastly, for the facial nerve sensation, we also have the somatic duty, which is to give sensation to a very small region near the EAM, the external auditory meatus. So it's time to delve into the actual pathway that this nerve takes. So this image is packed for sure with information. Now the reason why I went over the functions first is so that you can understand why it's so packed with information. Motor nerves are going to be different from sensory nerves, which are going to be different within themselves. They have very specific tasks for different nerves. I want you to divide the facial nerve into two parts, sensory and motor. First, I want to talk about sensory. I want you to find where it says the geniculate ganglion. This is a sensory ganglion. So cell bodies originate in this ganglion and receive information from its nerve endings at locations of where it innervates. So the two things that this ganglion receives information from are the taste, again we experience this at the anterior 2/3 of our tongue, as well as the sensation of that little tiny small region near the EAM, external auditory meatus. So let's talk about taste in particular. Let's look at that green cell body that originates in the geniculate ganglion. This is actually the lingual nerve, which is part of the trigeminal nerve, cranial nerve V. The facial nerve has a branch that ends up meeting with this nerve and travels along the same route to the same location, which is at the tongue, specifically anterior 2/3 of it. The facial nerve that meets up with it is called the chorda tympani. This nerve gets the taste information to the geniculate ganglion, facial nerve, taste sensation, trigeminal nerve, somatic sensation, pain, temperature, touch. Both of them, however, go to the anterior 2/3 of the mouth. So I keep repeating it because sometimes it gets confusing. Now in this picture, you really only see the green color go to the nerve, which is the lingual trigeminal nerve. But just know that the chorda tympani goes there as well. That's part of the facial nerve. This image gives a little bit more information about the taste pathway. So you're going to see the chorda tympani going up to the geniculate ganglion to where it then enters the brainstem and that pontomedullary junction. So you'll see that it ascends to then send the information to both sides of the brain. So there are bilateral projections. Now let's talk about the motor involvement. So let's start at the facial nucleus, then follow that orange line, and you'll see that after it reaches the geniculate ganglion, it passes that and ends up bifurcating, meaning splitting. So if you look closely at the bifurcation, you're going to see that there's a very short branch that trails off. And this little short one, specifically shows that it innervates the stapedius muscle. Then the other branch, a very long branch, ends up coming out of the stylomastoid foramen and branches into a bunch of different motor branches. These are the ones that we're most familiar with when we're talking about the facial nerve. So temporal branch, zygomatic, buccal, mandibular, cervical branch. These are all the ones that supply the muscles of the face, allowing us to express our emotions. Now, just note the stylomastoid foramen and all the roots that you see coming out of it. Of course, you see that there are 5 branches, the ones that we just talked about, the ones I just listed. Now, you're also going to see the posterior auricular branch that we've mentioned prior. This one actually gives sensation of the region near the external auditory meatus. There are also branches that come out of this foramen. However, in this image, we cannot see them because they are just honestly too small to fit in this image. These, however, though, are motor branches that give the remaining muscles that we've talked about before, that it innervates: posterior belly of the digastric muscle, stylohyoid muscle. So always just keep those things in mind. Now let's talk about one more motor aspect of the facial nerve, the parasympathetic involvement. So parasympathetic will always have a preganglionic and postganglionic nerve. Unlike the sympathetic system, the parasympathetic system will have communication between the pre- and postganglionic nerves nearby the target organ, or actually at the target organ. So the parasympathetic involvement has to do with the lacrimal glands as well as the salivary glands. Let's talk about the pathway that goes to the lacrimal gland. So we're going to start off at the superior salivatory nucleus. This is at the level of the brainstem. This is the yellow nucleus that you see on the screen. This is where the preganglionic parasympathetic fibers begin. You're going to follow the yellow line and you're going to see that it ends up becoming a branch called the greater petrosal nerve. And eventually this nerve makes its way to the sphenopalatine ganglion. And this is where the preganglionic meets up with the postganglionic parasympathetic nerve. Ultimately, this is going to travel to the lacrimal gland. Lastly, let's talk about the root of the salivary glands that this nerve innervates. We start at the superior salivatory nucleus. This is where the preganglionic parasympathetic fibers are. We follow the root and see that it turns into the chorda tympani. And yes, we have already talked about this. So this nerve has two functions. But we continue on with the chorda tympani until we reach the postganglionic nerve, which is in the submandibular ganglion. Then from here, the postganglionic nerve then goes to supply the sublingual gland and submandibular gland. As we know, the facial nerve has both sensory and motor functions. Whenever you're testing a nerve, just in general, you're just trying to see whether or not the functions that we've already talked about are performing properly and as expected. So that's what we're going to do. The two main things that we test for in Cranial 7 are our taste and the ability to use our facial muscles. So think about comparing symmetry. So for taste, what you can do is apply a sweet or sour or salty solution to their tongue. And you're going to do it on one side of the tongue at a time. Obviously, you're trying to see if they can identify the flavor. Then for facial muscle activation, what you're going to have your patient do is use their facial muscles. So have them smile, show their teeth, close their eyes, puffing out their cheeks, raising their eyebrows, tightly closing their eyes. So again, you're looking for symmetry. So you want to see, can the right eyebrow lift as high as the left eyebrow and things like that. So yes, we have talked about a lot of other functions of of the facial nerve. However, I personally will say, you know what? It's okay to not have my patient cry to test out their lacrimal glands. Or I'm okay not seeing my patient spit and assessing their salivary glands, right? So sometimes you don't have to test everything to see whether or not that nerve is working. I hope you enjoyed this video, and hopefully Cranial Nerve 7 makes more sense now. Check out this reference if you want more information.